Well, it's now 6 months since we went into lockdown. We're told that test, track and trace is the key to unlock the pandemic. But is it working? It's supposed to happen like this. If you get a positive test, the tracers get in touch with all of your contacts and everybody involved goes into isolation. But of course, it falls down if you can't get a test. And for lots of people, that's exactly what's happening. Here's Simon Dedman.
Hi, I'm Vicky Stedman with my son Harry, who's...
Across the East, hundreds have been attempting to get a test. Vicky Stedman has been trying to get one for her son Harry in Clacton since last Saturday, when he developed a persistent cough and high temperature.
I have tried non-stop to get an appointment, as has his father, as has my mum. It's extremely stressful, you know, trying to keep your job as well as looking after a young child, and yet you're told to do all these basic checks and everything else, and we've done that, but there's no appointments.
I feel better, but it's kind of hard not being able to go back to school for a long time, because I haven't been able to go back to school for 6 months. And it's really annoying because I have to interrupt my mum going to work, and my sister has to go to my nan's for a couple of days, so she doesn't have to go off school.
They are not alone. Hundreds queued at a Southend walkthrough centre this week, and many were turned away. BBC Essex filmed a mobile test centre closing at 3 p.m. in Basildon.
The problem locally is the lack of laboratory capacity, and there's no point testing people if indeed then gets held up in the bottleneck of the laboratories. So we're working hard to create new laboratories, to free up the existing laboratories so that they can concentrate on those tests. But again, it's important we remember to only request a test and only go for a test if you meet the criteria that's clearly on the government website and elsewhere.
The testing coordinator for the Eastern region says some people asking for tests don't have symptoms.
Between 25 and 30% who are trying to access testing actually don't need it. So it's important that people remember the criteria for testing, that it is people who are symptomatic or a member of their family who are symptomatic, and not just people who want to know.
But for those who have symptoms and can't get a test at sites like this one in Colchester, there is a potential knock-on effect for all of us.
Good afternoon, I'm Niall, calling from the Essex and Southend Contact Tracing Service. We're part of the local public health response and trying to understand where you may have caught the virus yourself.
Positive cases that aren't confirmed can't be contacted by the track and trace system, who work to prevent the spread of coronavirus.
Yeah, if people are not able to get tests and they're then not going into isolation as they should be, then that could see a rise, and it could cause an issue to us not having their contact details.
Across our region, more than 8,500 people who could be infected with COVID-19 had not been found by the track and trace system. Northamptonshire has the highest number at 2,092, while in Milton Keynes there were 251 people who couldn't be tracked down.
I think it's really difficult because there are so many different levels that people might be contacted. So there is the national test and trace who may have contacted and we're not able to, or it might have been the national team haven't been able to contact but then we are. So I think that the number who absolutely no one can get in contact with is a lot smaller. And like I say, I think we just have to hope that people are doing what they know that they should be doing, which is staying at home, staying away from people until such time as they've completed their isolation period.
You know, we're seeing this spike that people aren't always behaving themselves and out and about, especially in bars, pubs, clubs. Once you have a bit to drink, that there are some issues there in terms of not following social distancing rules. Some of those new behaviours get forgotten and the old behaviours creep in.
Success. Thursday evening, Harry has got a test. They are waiting for the results, waiting to be able to get back to work and school.
Well, we saw those pictures of the queues in Southend. Some questions then for the local director of public health.
Unfortunately, it's because of the high demand on testing, we've seen a huge rise in other people outside of the area attending testing at the site through a booking system, but also we have some challenge about people thinking it's a walk-in facility, they can just walk there and get a test.
Are you concerned that people are coming for tests or trying to book a test when they don't really need to? Perhaps they've got a runny nose or something, but not COVID symptoms.
We are hearing some information to that effect, Stewart, that people are feeling it's a bit like the worried well, isn't it, telling about the GP practice.
And how long do you think it will be before everybody who wants a test, not needs a test, wants a test, will be able to get one?
I couldn't tell you that, I'll be honest with you. We are just about coping with the current demand. And if we feel that currently we anticipate about 30 to 35% of those who are probably symptomatic, or some of people are also asymptomatic but carriers of the virus, are coming forward for a test. So if you think about the challenge we are facing now, if actually you were to consider that everybody needs to get a test, I think this is a long, long way away.
And if track and trace is the answer to the pandemic, if we can't test people, then we can't trace people. It's not the answer, is it?
Well, for the time being, this is the bread and butter of public health. This is what we know we should be doing. Capacity needs to be increased for both testing and being able to turn around the results very quickly. And that is the national challenge for the government. The government must make sure that we have got the ability to do that, to enable public health to undertake what is required on the ground and prevent the virus spreading and causing outbreaks that then leads to local lockdowns potentially and more serious national restrictions.
But does it worry you that if we can't test enough people, there could be a lot of people in Southend that we need to track and trace after their test, and we can't do it because they can't get a test?
Oh, absolutely, completely. It keeps me awake, to be honest, Stewart. It's about everything we put in place to minimise the risk of the spread. We have a team every day looking at the data and contacting people, tracing people, and we're doing our best to make sure people who've been lost or what we call failed to the follow-up service, we are trying to find ways to reach them, which may need us putting on the ground some door-knocking facilities to do that over the next week or so. But yeah, it is a challenge for us because the only way we can contain this is being able to test people and trace those who have been close contacts to those who are positive.
Well, good luck with that, and thank you very much for being with us today.
You're welcome. Thank you.